Addiction is a disease of the human race. It is not a disease that discriminates. It does not hit one walk of life more than another walk of life. So all of us are at risk of becoming an addict depending upon what we're using, when we start using it, what our life circumstances can be.
So we really have to have treatments and responses and prevention for all stratum of society.
I'd like to see a world where everyone in their village has at least a basic understanding of addiction as a disease and where to turn for help. It's not the back of your insurance card. It's not the emergency room. It's better than that, and we want to help you get there.
There's a significant opportunity here to raise the level of awareness of addiction within our faith communities. They can provide ministry and help by really lifting the shame and stigma, just talking about it openly.
I never really believed that I could get clean. 18 years that I tried, and I never believed I actually could do it. And it's so important to me today that I can say to other people struggling, you can do it.
CBS presents Faith, Hope, and the Burden of Addiction. The narrator is Ted Holmes.
According to the Centers for Disease Control, over 110 Americans die every day from a drug overdose.
We are having more deaths from opioids in this country today than we have from car accidents and gunshot wounds combined.
When you talk to parents and other people who've been affected by this, who have lost sons and daughters, it's really tragic in terms of what's happening now with prescription pain medication and heroin.
I wish we had known so much that we don't know today. I know today about what constitutes addiction and what you have to do to save a life.
Reverend Richard Cizik, an evangelical pastor, is a prominent social justice advocate in Washington, D.C.
If you're not up to speed and you have a child, you're playing with his or her life.
On December 19, 2013, his eldest son, Richie, died of a heroin overdose at the family's home in Fredericksburg, Virginia.
Richie was a 23-year-old with lots of life. He loved music, he simply loved life, and he exhibited that gregariousness to everyone. Everyone loved him, and he loved them.
An avid skateboarder, Richie broke his wrist and was prescribed the painkiller OxyContin.
It didn't even occur to me at the time that this was something that could potentially endanger his life.
The doctor failed to reveal how addictive OxyContin is.
This was a period of time when this was commonplace. No one thought anything about it. And then when OxyContin, wasn't available, apparently he shifted to a cheaper form of addiction, namely heroin. He hid it from us, he hid it from others, but he became an addict.
The family discovered Richie's secret when he passed out in a public bathroom and was arrested.
I persuaded him, you have to go to treatment, because he was a 23-year-old who simply had the perception of his own capacity that he could do this, he could fix it on his own without going to treatment. Moreover, he was worried about what treatment might mean. It would go on his public record. Could he get a government job? There were all these impediments that he had. I said, it doesn't matter. You have to do this.
Richie was in treatment for 6 weeks. He came home for Thanksgiving and Christmas and was planning to return to a new facility in January.
He came home, a changed young man who was so happy, beefing up after having lost weight, eating right, caring for himself, his body, and moreover, I think spiritually changed as well. He knew he was somebody finally who really was not only worthy of being loved by others, but loved by God, and he wanted to share that with other people. He came home, and then within a matter of days, he was gone.
Cizik was never informed that while his son was away from the treatment center, he had a 90% chance of a relapse.
We knew that he faced challenges, let's face it, but never would we have ever in our right minds have allowed him home, even for the holidays, if we had known this was the most dangerous place for him.
Richie also had his cell phone back. Without the family knowing, his dealer got in touch with him.
A drug dealer who had previously supplied him with heroin, who knew he was clean, and nonetheless sold him heroin. And it was in this very room. I said, Richie, help me trim the tree. He said, I'm going out for breakfast. I said, I'll fix you breakfast. He said, no, I'll be back in just a few minutes. He was. I went up to shower, and then I heard the screams from his brother saying, Dad, Dad. And so we tried to revive him. He was in my arms, his head in my left arm. 911 on the phone in the right hand, calling, asking for help, and praying all at the same time, dear God, don't let my son die. And he died in my arms just before Christmas.
Today, Cizik is speaking out about the loss of his son. He believes the public should be better informed about addiction, and the faith community should play a role in this.
What is the most unforgivable, in my humble estimation, is that the church, what ought to be a healing ministry, doesn't even recognize drug addicts in its presence.
Recently, Cizik formed a drug addiction task force. They meet in the basement of his church in Fredericksburg, Virginia. Toby Larson is the pastor here.
I'm embarrassed. I never said the word heroin. I don't even think I said the word drugs from the pulpit in 10 years. Shame on me.
It's a chance to hear from those who have been affected by the disease.
He was blown up in vehicles twice in Iraq. He had back injuries. He had problems with pain. Back and forth to doctors. This is VA answer. This is the VA's answer.
Dave didn't think he was going to die that night. My daughter used to say, I'm always afraid the day that he doesn't come out of the bathroom. That was the day. She tried to resuscitate him. He died on the way to the hospital.
The Reverend Luke Lucas is an Anglican pastor from South Carolina. He shared the story of his son Ben, who died 3 years ago of a heroin overdose. He was 22.
He kept trying to tell me that the systems that he had tried to get help from were failing him. He tried to tell me that it wasn't enough whatever was being done for him.
Most of what Lucas knows about addiction, he learned in the wake of his son's death.
Now I know that in this country the 12-step paradigm is still very strongly in place. And I'm not knocking it so much as to say that's not enough. We, at one point, got him down to Florida and did a rapid detox where they flush the brain in the tissues with chemicals in a few days, supposedly rids them of the opiates, and that he came home clean.
A few days later, he was back on heroin and nearly died of an overdose.
I know he had this sense that he didn't think he'd live out a very long life. And I couldn't put it all together. I couldn't put it all together because I didn't know. I didn't know that overwhelmingly heroin addicts that get clean will most probably relapse. It's not them doing it. It's what's in their brain has taken over and is calling the shots. It's not them anymore. I can't tell you how many times I said over and over again, my son died on my watch. He died on my watch. What? How could I be so stupid? How could I have let this happen?
We will return after these messages.
Scientific advances over the last 45 years have changed how we understand addiction. According to researchers, the science is clear. It's a disease of the brain.
What happens in addiction is that the region of the brain that's responsible for motivation, for reward, for feeling good, is vulnerable to medicines or street drugs like heroin, morphine, OxyContin, Vicodin. And when an individual who has that vulnerability takes those drugs, they get a reward, a pleasure, a euphoria from them that is excessive.
Dependency on prescription painkillers can happen through recreational use or even a doctor's prescription. Who is at risk for dependency is based on a number of factors, including genetics, family history, and mental health.
Once they get into that pattern, it becomes compelling, compulsive, and when we say addictive, it means it dominates behavior. They have a feeling that they can't live without it.
In recent years, stricter regulations on doctors who prescribe painkillers brought unintended consequences.
When we have a population of people across the country who are dependent on prescription opioids that they got from the doctor, and now that we're starting to educate doctors better, and they're saying, I'm not writing those narcotic prescriptions anymore, what's happening? Those patients, in the absence of treatment, they are turning to heroin. And so we have the return of a heroin epidemic in place of the previous prescription opioid epidemic. It's whack-a-mole.
Users quickly develop a tolerance, and soon their lives are spiraling out of control.
We know that newer users to heroin, about 4/5 of them started misusing prescription pain medication. And even though it appears to be a small percentage or transitioning, it's really disturbing to see kind of this newer, younger, very naive cohort of people who have now begun to use heroin.
The CDC recently reported that in 2013, over 8,200 Americans died of a heroin overdose. More than half of those deaths were white people, ages 18 to 44.
We used to consider heroin a real urban issue, but now we are seeing this across the country in suburban areas, in rural areas. So it's really challenged us to make sure that we have an adequate response and adequate infrastructure to deal with this.
The Obama administration considers illicit drug use a public health issue, not a criminal justice problem.
We clearly know by science and research that substance use is a disease. It's not a moral failing. It's not a criminal justice issue. So all of our policy is shaped by that understanding that arresting and incarcerating people does little to change their trajectory and change their addiction. And we also have a growing armamentarium of what we know as effective prevention, intervention, and treatment services.
Today, only 1 in 9 people with a substance use disorder seeks treatment.
Drug addiction is the one disease that disrupts the ability to see whether you have a disease. And that's why they need help even before they realize they need help.
Treatment can also be costly. But with the Affordable Care Act, more people should have access to better treatment.
What the Affordable Care Act does is say not only do you have to offer a benefit, but you have to offer that benefit on par with other medical conditions.
Addiction is a complex disease, and there are many factors that determine the best course of treatment. In the case of opioid addiction, an abstinence-based approach is not recommended.
The vast majority of people who become addicted to opioids can't go cold turkey.
For those who seek abstinence-only treatment, the rate of relapse is 90%.
It's not because the patient doesn't want to get better. It's because biologically their system is not wired to be better. In fact, the only scientifically reasonable thing to expect is that they will work their hardest to continue getting their supply of a drug.
Inpatient treatment may be required. There's also a need for good aftercare. A combination of counseling, therapy, and anti-craving medications such as Suboxone or Vivitrol are recommended.
It's totally a myth that you can't treat drug addiction with a drug. You can and you should. You're only using the drug to provide a foundation of stability for the brain to learn what counseling and psychology and AA and Narcotics Anonymous, NA, what all of these have to teach.
Recovery can take a long time.
One of the things people need to keep in mind, like diabetes, like heart disease, like the other chronic conditions, it will require lifelong treatment, and treatment can take many forms. It doesn't mean that it's lifelong rehab. It doesn't mean that it has to be continual therapy. but there may be slips, there may be relapses, and retreatment may be needed.
Prevention and intervention are also important, especially with young people.
We could lose an entire generation because we have become very lax in understanding the pitfalls of substance use. And part of it is because the perceived risk of use is greatly lower than it was many years ago. And that's problematic because the earlier you start, the more likelihood you'll have an addiction disorder. I think many times parents say, I did it as a kid and I'm fine, but the risks today are much greater. The drugs are much stronger, the drugs are highly addictive, and they're much more available.
Sober now for 26 years, Botticelli wants all addicts to receive the help they need.
I look back at my own trajectory. You know, I came from a home that had addiction in it, and I started using from a very young age, and my disease progressed until I had an intersection with the criminal justice system. And I look back and say, it didn't have to happen that way. I'm one of an estimated 23 million people who've gone on to live long, productive, happy, loving lives. And we want that for everybody. And we know that that's possible for everybody.
We will return after these messages.
Scituate is a small, well-to-do seacoast town on the south shore of Massachusetts. But like many towns across America, there's a growing concern about the prescription drug and heroin epidemic. In 2013, over 900 people died of an opioid overdose in the state of Massachusetts.
I'm here because I lost a 22-year-old cousin to heroin who was coming from a wonderful family and started just with surgery on his teeth, and within 3 years was gone.
Anne Marie Galvin is a long-term resident and mother of 4.
There was an overdose death that came to my attention, a family who lost their son after a relapse, and that's when I began to do a little bit of research into what was going on very locally and in the broader community.
And with that, a community activist was born. She brought together local law enforcement, school officials, and recovery experts to address the issue.
So that's what we did in that first fall, is really getting people, parents and young people and people in the treatment industry around the table to kind of talk about what's going on here. Is it really a problem, kind of thing.
Today, the organization Galvin co-founded is known as Scituate Facts.
Hello, everyone.
Part of their outreach work includes monthly community meetings.
People come to me often and say, thank you for creating a forum where I can go. My family has been struggling with this, and there was nowhere to go before, and now I feel less ashamed. And we know that we're not alone.
Mike Stewart is the Scituate police chief.
We can't arrest our way out of this. All right, this is beyond a simple law enforcement strategies and techniques and things that we, police are designed to do. The programs and the efforts that you see and hear in this room, this stuff's going to make a difference.
It's a chance for the community to learn about at-risk behavior.
Students are really starting with drugs like Ritalin and like Xanax and like marijuana and things like that. And it's not to say that those are gateway drugs, but it's a gateway behavior.
Treatment providers talk about what is working in their recovery programs.
We use recovery coaches. We started with 1, we now have 8. We're training 12 more over the next year. We use medications, they're called medication-assisted treatment, and we have all of the other psychosocial connections, but it's a very labor-intensive and a very personalized service.
Pastor Barbara Welch has been involved with Scituate Facts from the beginning.
I think the first piece we need to do is get the conversation going in the churches on an ongoing basis, so parents and young people can feel free to come in and talk to us and not feel like maybe I shouldn't go there with this kind of embarrassing issue.
In April of 2014, the local clergy partnered with Scituate Facts and held a community vigil at the high school.
We didn't want to do a church service. We just wanted to have people give testimonies about how they have struggled with their addiction issues and what we could do to help them. And I'll never forget one of the people speaking there that said, "Don't give up on us." And the 300 people that were there was like, "Don't worry, we're not going to give up on you."
Among those who shared their story was Megan Perry.
I feel like to have survived at all what I did to my body is a miracle. You know, it's an incredible blessing that I am as intact as I am physically. It's a huge gift.
Perry is originally from Scituate. Raised in an upper-middle-class family, she excelled at school, loved horseback riding, and was president of a 4-H club.
I was suffering from depression and anxiety, but I didn't know what that was. I found myself becoming withdrawn, not loving the activities anymore that I used to love, and really struggling socially. And I changed the kids that I was hanging around with, and I think I sought out the kids who were different and were troubled because they fit for me. And so in that way I was introduced to drinking and drugs. All of a sudden it was out of control very, very quickly.
Despite her addiction, she graduated from high school 1 year early.
I was in a traditional college setting, which meant there was very little supervision or rules. I had free reign to drink and smoke marijuana and do hallucinogens, all that I wanted, and I wanted a lot. And so I spent 3 semesters there and was really, really deeply, deeply depressed, struggling, really struggling.
She returned home for a semester before transferring to Emerson College in Boston.
And that's when things really escalated again, with my drug use and feeling like everything was out of control and just being very, very deeply unhappy.
Her parents knew she was troubled and wanted to help.
They tried a lot to get me into counseling and therapy, and I just really wouldn't participate in it. I knew that there were those avenues about mental health, but I had no idea about addiction. I didn't really even know what addiction was. So I think part of that is my own denial. I designed my life to use. I was able to do a semester abroad. Where did I choose to go? The Netherlands. You know, because that's where I knew that I could use more, and I could use more legally. And it was going to be, you know, a place I could party hard, and that seemed very, very attractive to me at 20 years old.
After studying abroad for a year, she returned to Boston.
When I came back from Europe, I was introduced to heroin and crack cocaine. Once I decided that I liked heroin the best, and I started using heroin every day, it was about 3 or 4 months that it took to graduate to the point where I was completely devastated by it. It took everything. I graduated college a heroin addict. I had to do heroin before I went to graduation so that I wouldn't be sick at graduation.
For the next 15 years, she struggled to get her addiction under control. Meanwhile, she got married and had a daughter, Sophie.
I had her for the first 4 years, and then I relapsed, and I lost everything in 4 months, from when I picked up to when my house, my job, my car, my husband, and my child were all gone. I lost custody of her because I couldn't take care of her because I was using. I was living on the street. I had nothing. I had the clothes that I had on, and I ended up in, you know, sleeping on people's couches or in an alley or at the homeless shelter with just this one outfit and no contact with her. And that was definitely the darkest days.
Perry used different forms of treatment to heal her mind and body. She was prescribed anti-craving medications.
The times that I was on methadone or on Suboxone, I feel I would have died without that medicine. They are widely abused, which is an unfortunate piece that goes with them. However, I believe that they absolutely need to be there and that that's the right pathway for many, many people.
Despite numerous attempts, she could not remain clean for a year. Something was missing from her recovery.
I never addressed my spiritual self. I never understood it. I never knew that that was really where the healing needed to take place.
Facing 2 years in prison for drug trafficking, she asked the judge if she could enter a long-term, faith-based treatment program. Against all odds, he agreed.
I got the missing piece, which was that I needed to allow a higher power to love me, which allowed me to love myself, which then allowed me to let other people love me. And in that 9 months that I spent in that program, absolutely changed my life. Absolutely.
After leaving treatment, she found a support group and she joined a church, Harbor United Methodist in Scituate.
I walked in there 5 years ago and they accepted me, and that acceptance, that love, that community of love and that community of faith has held me up through all kinds of things.
Today, Perry and her daughter are back together. As an outspoken advocate for those who struggle to recover, Perry wants her story to be one of hope.
This disease takes all hope from those who are suffering, and from the families too. And it seems like you will never overcome it. 18 years that I tried, and I never believed I actually could do it. And it's so important to me today that I can say to other people struggling, you can do it. So I'm living proof that recovery works. It happens, and it's amazing.
To view this program and others like it, go to cbsnews.com/religion and culture.